Hello, future doctors. How are you all? Welcome back to MedSteps ECG series day 15 by Dr. Anand. So far, we have learned the ECG waves, intervals, cardiac axis, and heart rate calculations. So, today we will learn one of the most important rhythm topics. So, normal sinus rhythm versus sinus tachycardia. This is the one of the first things every doctor checks while reading, while interpreting ECG. By the end of this lecture, you will be able to differentiate a normal sinus rhythm from sinus tachycardia in less than 1 minute. So, without time waste, let's begin. So, what is sinus rhythm? A sinus rhythm means it's like electrical impulse starts from the originates from the sinoatrial node. So where you can find sinoatrial node in right atrium. So this SA node, in simply we call SA node. So the SA node is the natural pacemaker of the heart. It normally generates electrical impulses that travels through the atria, AV node, and ventricles. Okay. So what is normal sinus rhythm? A rhythm is called normal sinus rhythm when the impulse originates from SA node and the rhythm is regular and the heart rate is around 60 to 100 beats per minute. Okay, so then we call that is sinus rhythm. That is normal sinus rhythm. So five criteria we have for finding sinus um, normal sinus rhythm. So the five criteria will be like we have five criteria to find out the normal sinus rhythm. So the every ECG, whenever you are seeing interpreting ECG, should satisfy these five criteria. First one, heart rate. The heart rate must be 60 to 100 beats per minute. Next we can see rhythm. The rhythm will be like regular and all R waves are RR intervals are equal. Next you can see P wave. P wave is one normal P wave before every QRS complex. So next you can see PR interval. Constant PR interval will be like normal 0 to 12 and 0 to 20 seconds. That means around the PR interval we have to see around 3 to 5 small boxes. Okay, so that is PR interval we have to check. So next we can see that is QRS complex. The QRS complex must be narrow and less than 0.2 seconds, means less than 3 small boxes. Okay, so these are the things very important. This is the main criteria for finding normal sinus rhythm. How? One is heart rate, rhythm, P wave, PR interval, and QRS complex. So this is the main important things. Okay, so easy memory trick. How to remember this thing means we have one mnemonic memory trick, that is normal sinus rhythm. First one always every 5 P's. One is pacemaker, SA node, pulse 60 to 100 beats per minute, pattern regular rhythm, P wave before QRS, PR interval that's constant. Okay. Now what is sinus tachycardia? Sinus tachycardia is a rhythm where the impulse still starts from the SA node. So, but always the heart rate becomes greater than 100 beats per minute. Okay, so usually between 100 to 180 beats per minute, we call that is sinus tachycardia. So, in important point, you can see everything remains normal except the heart rate. The rhythm is still sinus. Okay, so the ECG features. What are the things you can see in ECG? If patient have sinus tachycardia, we have to look for heart rate greater than 100 beats per minute, and we have to check the regular rhythm and the normal P wave before every QRS complex, and the constant PR interval we can see, and narrow QRS complex. So this confirms QRS. This confirms sinus tachycardia. You can see here. So we call that is, if you are seeing this R wave, everything you will get like fork spoon, how it will look like that you will get. Okay, so this is sinus tachycardia. So now normal sinus compare with normal sinus rhythm and versus sinus tachycardia. So in futures, you can see first one, the current, the conduction happening in SA node in both. The heart rate you can see normal sinus rhythm 60 to 100 beats per minute. In sinus tachycardia greater than 100 beats per minute. The rhythm will be like both regular and regular. The P wave before every QRS, before every QRS. So the PR interval will be like normal, and the QRS complex will be like narrow. So only one change, that is in heart rate. Okay, so 60 to 100 means that is normal sinus rhythm. If more than 100 means it's a tachycardia, sinus tachycardia. Okay, so next you can see here what are the main causes. We can causes of sinus tachycardia means the sinus tachycardia is usually a physiological response. Like the common causes include exercise, anxiety, stress, pain, pregnancy. So these are the main causes in physiological things of sinus tachycardia. In pathological, we can see if patient have fever, if patient have any hypovolemia, dehydration, anemia, hyperthyroidism, or sepsis, or heart failure, or pulmonary embolism, or hypoxia, breathing related problems, anything as circulation problem, then the patient, it will become pathological and the patient will get sinus tachycardia. Next, drug. In drug induced, we can see adrenaline, salbutamol, caffeine, and nicotine. So these are the things will cause sinus tachycardia. Okay, so easy to memory, easy to remember this trick to find out the causes of sinus tachycardia, that that mnemonic will be like fast heart, because these are the things will cause tachycardia. So that's why we call simple fast heart. F means fever, A means anemia, S means stress or sepsis, T means thyrotoxicosis because of hyperthyroidism, hypovolemia, exercise, anxiety, respiratory diseases like hypoxia, pulmonary embolism, toxins, and stimulants. Okay, so for example, you can see here one clinical case. When I'm doing cardiology department, that time I saw this case. A 24 years old woman with fever. Patient presented. The pulse, you can see 120 beats per minute. The rhythm will be like regular. The P wave before every QRS is QRS and narrow QRS. Then easily we can tell that is sinus tachycardia because of greater than 120 beats per minute the heart rate. Secondary to fever. Okay. So next, is sinus tachycardia dangerous? Many patients and family members ask this question to me because they went for doing ECG. That time they told the heart rate is more. So maybe like that they told, so they got fear. So that's why they messaged me. That time I told them, not always the sinus tachycardia is dangerous. It is often a normal response to increased body demand, and however, persistent sinus tachycardia without an obvious causes should prompt evaluation for like infection, bleeding, pulmonary embolism, heart failure, and hyperthyroidism. We have to, if patient have this type of causes, comorbidities, we have to treat underlying cause, not just the heart rate. Okay, how to recognize? How to recognize sinus tachycardia? Is there a, always whenever you are doing ECG interpretation, always ask these 5 questions. Is there a P wave before QRS complex? Is this, is the rhythm is regular? Is the PR interval is normal? Is the QRS is narrow? Is the heart rate greater than 100 beats per minute? If everything is yes, then we have to suspect that is sinus tachycardia. So differential diagnosis of sinus tachycardia. Not every fast rhythm is sinus tachycardia because we have to differentiate it from supraventricular tachycardia. In upcoming videos, we will discuss this thing. Atrial flutter, atrial fibrillation, ventricular tachycardia. This everything we will cover in our upcoming videos. Okay. So at last, what we discussed today. In conclusion, normal sinus rhythm means heart rate must be 60 to 100 beats per minute, and rhythm will be like regular. P wave before QRS. PR interval will be like 0 to 12 to 0 to 20 seconds, means 3 to 5 boxes. Then and the QRS complex must be narrow. In sinus tachycardia, everything will be like same, but the heart rate will be like greater than 100 beats per minute. The main causes we can say fever, pain, anxiety, exercise, anemia, hypothyroidism, hypovolemia, sepsis, and pulmonary embolism, breathing related problems. Okay, so these are the things. So today we'll learn how to differentiate normal sinus rhythm from sinus tachycardia. Using this simple 5-step approach, we can interpret it properly. So in day 16, we will learn about sinus bradycardia, including its ECG features, causes, clinical significance, and when it required treatment. So if you didn't watch that day 1 to till day 15, you can if you're following the order, you will get good understanding about ECG. Okay, so we will meet in our next video. Till the time, take care.